Hello. This week we are coming to you from the hospital room
with a less than 24-hour-old baby. This is baby Hank.
Postpartum day 1.
Yeah, and really want to just take this episode to sit down and talk about all the key things for mom in this first day. Just in case it's your first time meeting us, I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I'm a board-certified OBGYN, and this is our third go-round here postpartum.
And we are the Doctors Bjorkman.
Postpartum day 1. What should mom expect, and what are your goals? How do we try to make this
Yeah, and just to remember this in that mental fog of having just given birth to a baby, we've got rest, recovery, and the 3 key B's that you're going to be focusing on in this 24 hours. So rest, recovery, and then bottom, boobs, and
bonding with the sweet little baby. So labor and delivery is a marathon. You may have a long induction, you may have a C-section. It is a whole thing that you need to rest and recover from. So in that postpartum period, you want to make sure that you are hydrating really well, drinking lots of water, and eating enough food. So often that's a great support person thing. Make sure you're ordering the breakfast, lunch, and dinner that the hospital will provide. So it's like something that you want instead of the random tray that comes with like meatloaf on it.
Yeah. And make sure that your partner's just getting the hydration and the calories they need to start producing breast milk for the baby and allow their body to heal from the marathon that they just went through in giving birth to a new human life, which, sometimes seems kind of natural, but also so important. And realizing that mom's going to be exhausted. And so keeping baby safe means having time for the partner to hold baby so mom can sleep, or making sure that the partner is doing diaper changes, etc. All of these things really helping to support the rest and recovery for mom. Step 1, goal 1 is make sure that mom is taken care of, that she can do the things that needs to happen for baby too. So, which then brings us to the 3 B's.
Yes. So
do you want to start with bonding? Right out of the gate, the key thing is bonding. In this baby-friendly hospital system that a whole lot of hospitals in the U.S. have really moved towards, is how do we help babies bond with mom as best as possible? And this is as much skin-to-skin time as possible right out the get-go.
So what that looks like is, when you are delivering, having, something easily accessible, the usually provided hospital gowns unsnap pretty quickly so that baby can go straight to your chest. I had a nursing bra on so that I could whip that down as soon as baby came to chest. And so those are just, you want easy access to your bare skin. It's also a partner thing, doing skin to skin with dad or other partner, also something very, very common. So that's kind of first step, bonding. This is your little.
And remember that bonding piece has so many important steps for mom's hormone release, for baby too, helping mom start to produce those hormones that are going to encourage the production of breast milk, really helping reduce rates of postpartum depression, and really helping babies start out with that great start in this key time of just spending time holding your baby skin to skin as much as safely possible, while still allowing mom that rest and recovery time that we started with.
And still usually possible in a C-section as well. It is a goal in the OR often. Now, this is obviously dependent on the situation and acuity of your OR status, needing to go to the operating room, but that is still something that can be a goal, is getting skin to skin as quickly as possible. And if for whatever reason your circumstances don't allow that, it is okay. You will get your snuggle time, and everything we'll get you there. In terms of boobs, sure.
Yeah.
If you are breastfeeding, your goal is to really stimulate that milk supply, 1, feed sweet little baby, 2, and protect your nipples is also right there. So feeding on demand, we kind of talked about some early feeding cues in our baby video. And so anytime baby is wanting to go to the breast, put them there. You can't do that too many times. It's stimulating your milk supply. They're getting colostrum.
Yeah.
There does get to a point where sometimes they just really like that non-nutritive sucking though, and that can be hard on your boobs. So if you find that's the case and you feel you're becoming a pacifier, it is okay to break the latch, let someone else hold them, give your breasts a break for a minute.
Yep. And I think it's important to say that something that, at least as a partner I watched as we've gone through now 3 different newborn periods, is that this process isn't as natural as it seems like it should be. And sometimes like baby's got to learn, mom's got to learn that whole latching process. And even as I've watched you this time as compared with other times, like, oh no, baby, you need to get a better latch, and how you work with baby to do that. And so if this is something you're new at, talk to your nurses, talk to your lactation consultants. Like, it's this thing that feels like it should be so easy and natural, but it is not.
Not
and
at
so
all.
like, don't feel bad. Like,
They're not good at it. Their mouths are tiny. Like, it takes some practice for them to get good at latching, for you to understand what feels right. If it's super painful, if you have what we kind of call lipstick shaped nipples after you get done, they're kind of pointy, looking like a top of the lipstick, seek help. Just see a lactation consultant when you're at the hospital, because it's a resource that's there and available, and they are so experienced and know all the tips and can really help you understand a deep latch, some of those breastfeeding 101 things, which we can certainly do an episode on. But
and realize that the goal in this first day or two is not to really get a big volume of breast milk into baby, but just that baby is spending time at the breast to stimulate production of that breast milk. Again, their stomach on day 1 is less than the size of the pointer of your pinky finger. And so it's not about volume, but just getting those first couple drops of that thick gold colostrum that's got all the antibodies that are going to help them fight infections and really get the milk production for mom going. Again, not about volume, but just time on the boob.
And there's different nipple care things. Very into nipple care here. Often the hospital will have lanolin or different creams. There's nipple butters. Personally, I have used silverettes. They're these little silver cups that help with moist wound healing. And
you got those on Amazon, I think, right? Is that?
I think
we'll give you a link, because you have loved these for all of our kids so much.
These I literally keep in my jewelry box between kids. And so when it was time for this one, I said, oh, we got to pack the silverettes, and pulled them out of the jewelry box.
And I had them in my chest pocket during the delivery of baby boy, because I knew she was going to want them right away.
I didn't love nipple butters and stuff because it's like kind of greasy. It stains clothes. And so these have been lifesavers. You just have them on your nips anytime you are not nursing the baby. And they really, really help with your nipples. Okay. So
awesome. So
that's
rest recovery, bonding, boobs, and bottom. What are the key things for taking care of your bottom?
Yes. So vaginal delivery or C-section, you are going to have some recovery. Really exciting with this guy is he was significantly bigger than his brother and sister. So that was a surprise.
An extra 2 pounds bigger,
Yeah, they were barely 7 and he was almost 9. So anyway, your pelvic floor, your vagina, your bottom is going to be sore. If you have a C-section, you are having major abdominal surgery that you are going to be recovering from. And so it is really important to give yourself time to heal. You just ran a marathon, had major abdominal surgery. This is again, things you need to rest and recover from. So bottom things that we love, I love, your hospital will most likely have a peri bottle. You can fill this up with water, and then generally you use this to clean off your vulva, vagina, and as you're peeing, you may notice that if you have cuts, if you have stitches, that burns when you pee. So you kind of squirt as you pee to get things cleaned off. Then you don't have to wipe with toilet paper. You are just all clean and fresh. The hospital usually will provide large pads. Often they have one of my personal favorites, ice padsicles. You crack it and it cools. Sprinkle a little water on the top of it and it gets nice and cold. You put these in your fancy mesh undies. to really help with swelling throughout the day.
And you said that kind of fast, but just I know you found that like if you sprinkle a little water on it, it gets much colder.
Much colder.
Okay.
Yes. So crack them and then just sprinkle a little water on top and they get way colder.
When do you use heat ever too?
You can. So one of the things you may find, that you will find, as you're postpartum, your uterus that was once housing your baby has to contract back down for many reasons. Most importantly, to stop that bleeding after the placenta comes out, it contracts back down, constricts those blood vessels, and keeps you from bleeding. That is why often most hospitals will give oxytocin postpartum to really help that uterus contract back down. It is unpleasant. It's like a giant cramp, and you may notice it multiple times while baby's nursing, because the nursing stimulates oxytocin, which is the endogenous hormone that again is going to cramp that uterus down. So sometimes people really like a heat pack for that, ice pack, whatever feels good. In terms of the bottom care or incision care, taking some medication over the counter like Tylenol, acetaminophen, and ibuprofen or Motrin are great. They work in slightly different ways and help with some minimal to medium pain relief. Sure. Yep. And so
I feel like a bowel regimen is really important too. Is that?
Indeed. You really don't want to have to push. You want a mush for those first bowel movements, because again, you may have stitches in your vagina. Same with your abdomen. If you have a C-section incision, you don't want to like have to increase a lot of intra-abdominal pressure. You just want things to be calm and gentle there. Sitz baths, it's fine to sit in a bathtub of some warm water with some very mild scent-free white kind of Dove soap. Swish things around. I like baths. If you're sitting in a tub of clean water for 10 to 15 minutes, totally fine. Your OB is going to say, hey, don't go swimming, don't go in a pool, wait until everything is healed. And that is because, again, your cervix is open. We don't want a bunch of nasty to go up into your uterus and cause infection.
I think I'm trying to think of like things as partner that have been good is, you know, my role is to make sure you're getting meds on time. So like keeping that calendar or that clock in my mind of saying like, hey, let's make sure you get your Tylenol, ibuprofen, make sure you're getting your Colate, or whatever stool softener you are. Something I remember from earlier pregnancies, that postpartum period was just like, sometimes it was really uncomfortable. I felt like for you to stand for long periods of time.
You feel a little like your pelvic floor, your vagina might fall out sometimes. It's very intense. And so, yes, a lot of times Kurt will bring me the baby and he'll do the diaper changes and things like that. So I don't have to walk around a ton, which is nice. It's just a physically exhausting thing.
Yeah, but you can get through it, and you have this wonderful little beautiful baby to snuggle as you go through it too. So
indeed.
Anything we missed?
C-section recovery is different. Again, major abdominal surgery. A lot of moms postpartum really like an abdominal binder to just help that, again, help your abdominal wall feel supported. Staying on top of your pain meds there as well. There's a new culture, which is good and important, of trying to minimize the use of narcotic medications. For many reasons, the opioid epidemic, as well as constipation and different things. And there are multimodal ways to address pain. But again, you had major surgery. If you are really, really uncomfortable, ask for some more pain meds, because there are stronger things. Most of the time, C-section patients will stay in the hospital for 2 to 3 days at least, just to make sure that you're peeing, that you can walk around, that everything's going well. And so that usually leads to a little bit longer stay in the hospital. So that is kind of the pro tips.
Yeah, so just to summarize that again. So again, key things: rest and recovery for mom, good hydration, good nutrition, getting some rest.
Yep.
And then the 3 Bs.
Your boobs. Take care of them. Get the baby to the breast frequently. See a lactation consultant when you're at the hospital if that is one of your goals. Breastfeeding is not natural. It's the hardest thing I've done. I thought it was way, way harder than ever expected. So seek help while you have it available around you.
Okay. The next B is bonding. Make sure you're spending lots of time skin to skin. Good for mom's psyche, good for baby, good for everyone.
And your bottom. Take care of it. Stay on top of your pain meds, ice packs, peri bottles. I have multiple in multiple places throughout the house. I have one in the car if we like stop to use a rest area or public bathroom.
And make sure if you're the partner that you're helping keep on top of meds, carry the baby, do tasks so that your partner isn't straining if they don't have to.
Yes.
Anyway,
and bravo.
Yeah.
You did great work, and it gets easier and you will get better. So congratulations.
Yeah. Good luck, guys.
Yeah.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.